Well, team, I think we're ready. We have many people gathered and it's 12:02, so why don't we get started? Good afternoon. My name is Patrick Sieb and I'm Director of Economic Development and Placemaking for Destination Medical Center here in Rochester, Minnesota. And I'm joined by colleagues Aaron O'Brien, Bill Von Bank, Chris Shad, and Lisa Clark. And together we are pleased to thank you for joining us for this second in a week-long webinar series about reopening the economy. And we had a really great session yesterday, and I say week-long, it really in many ways kicked off 10 days ago when we had a gathering with the construction industry to talk about how to reopen the construction industry and how to keep people safe. And that led to this week-long series that kicked off yesterday, visiting with leaders in the office space environment to help thinking about bringing back office workers. And today we have a wonderful panel of transportation experts, people who are in the business of planning and operating transportation parts of the transportation industry. And we're going to gain their insights about how they're thinking about the safety and security of their workers and their customers while creating a compelling experience. So super excited to welcome our panel today. And it's very timely as leadership in the state of Minnesota, Governor Walz has begun the process of reopening Minnesota. And what has been for me so compelling about his approach and the approach of his commissioners is that they've really said this is both a top-down and a bottom-up approach, that we want to provide guidance because we have access to science and to the Department of Health and to CDC and some information that can help provide guidance. But we know that we don't operate businesses as state government. What they do is provide leadership, but they're looking for answers from the community. And so this webinar series is designed to help be a part of that, to be a part of the conversation about best practices and new ideas and innovations to bring about a safe reopening of the economy. And the goal with this is really that, a conversation to hear ideas. And we're going to hear from this panel who will talk to us about things they're doing, ideas that they're going to try, and lessons that they've learned. I expect this to be both inspiring and practical as we work together to figure out a safe, healthy, and compelling work environment. So let me introduce our panel today. We have with us Charlie Zelle, who is chair of the Metropolitan Council. Charlie has many years, can I say many years of transportation experience, Charlie, both in the private sector and in the public sector, as commissioner of MnDOT for 6 years and owner and operator, now chairman of Jefferson Lines, which operates in 14 states, but presently head of the Metropolitan Council, chair of the Metropolitan Council, which is a regional planning and operating government enterprise in the greater MSP area, which does transit operations, long-term planning, and metro mobility, and a whole lot of other things. I think you do sewer and water too. So there's a lot we can learn from the experiences that you have, Charlie. And John Reed, who runs the Rochester International Airport. I emphasize international. This is an international airport, and he's our executive director with more than 29 years, which means close to 30 years of aviation experience. Someday soon you'll be able to say 30 years of aviation experience, John. That airport, by the way, is a subsidiary of Mayo Clinic and has been since 1928. So I suspect John benefits from the insights and science and intelligence coming out of Mayo Clinic.
Absolutely.
Which has been at the forefront of our thinking here locally and nationally about how to combat this pandemic. Xiong with the city of Rochester. She comes to us via Metropolitan Council and before that MnDOT. So she and Charlie have worked alongside each other perhaps, but not knowing each other until being on this webinar. So they've been in the same field, but Ia is our transportation manager, City of Rochester, transportation manager. And what's exciting about Ia's work is that she's really the intersection between transit operations and and land use planning, and thinking about how land development and transit works together. And Laura Elwood, who is with Chamberlain Concierge, owner and operator of that business for 4 years, founded it 4 years ago. And before that, in a family business, family transportation business. So Laura is, her work is in private transportation. She's the owner and operator, and clearly very concerned about how to effectively and safely bring about transportation services. Transportation has been is an essential service, so it has been operating during this period of the Great Pause, as it's often referred to. So there are some lessons that we're going to learn today from people who have been operating during this period of time. For the audience, and we're so pleased to have all of you join today, there is the function in the Zoom webinar that allows you to ask questions, and we really encourage you to do that. And we'll be fielding those questions throughout this panel discussion. And we're looking forward to any questions or ideas that you have. And again, I think even it's called question and answers, but really it should be more than that. If you have ideas or suggestions, things that you've seen, we'd love for you to post them in this Q&A box. And we'll talk about those ideas as well. Before we move to our discussion, we want to ask you, the audience, a couple of questions to help us better shape this presentation. So we're going to first find out where you're from. We'd like to get a sense of where our audience is from. So we have a very simple question. It'll take you 5 seconds to answer. And once you do, that little pop-up box will go away and you can be back on your main screen. This is not a multiple choice. You only pick one. Good. Why don't we take a look to see where our audience is from? Wonderful. So we have more than 100 participants. 64%, 65% are from parts of Minnesota outside of Rochester. So Charlie, you are a draw. You're there are people outside of Rochester who are watching what you're doing here, so you better be on your best behavior. And of course, many people from Rochester, and then we have people joining us from other parts of the country. Great. Now, another question for the audience is, again, will help inform our panelists as they shape their presentations. We have a question to just help us understand what you came to learn, what you most want to learn about in today's session. We'll give you just another moment or two to respond. Are you most interested in immediate changes, long-term issues, a better understanding of the governor's expectations around COVID-19 preparedness, or lessons from businesses that have stayed open, or perhaps countries that have reopened? And I trust John is paying attention to that, and given he runs an international airport, and perhaps others have been connected with other countries as well. So great, why don't we take a look at what, well, people came to hear about what you guys are doing as you've stayed open. So that's one thing. So we're hoping that you guys have got it all solved, and you're going to tell everybody what the solutions are. And so long-term, people are interested in long-term solutions as well. So with that, why don't we begin by just talking about the framework that the governor has helped create as businesses in Minnesota are encouraged to begin reopening. And when I say encouraged within a framework. So on Minnesota DEED's website, Minnesota Department of Employment and Economic Development website, their homepage, front and center, is a button, safely returning to work. So it's front and center. So much effort has come out of DEED to help our economy and help our communities begin returning to work. Clicking that button will take you to another page that looks at, provides you with buttons to direct you to further information. And then going from there, and we can skip this one and go directly to the outline that has been served up as what's called a preparedness plan requirements checklist. And so this is the guidance that businesses have received from the state of Minnesota to understand how to prepare for reopening. And I think it's a framework, and having talked to the panelists in preparation for this, it's a framework that may have only been around for 36 hours or 72 hours, but it's probably a framework that they are very familiar with. And with that, I'm going to turn to Charlie Zelle, who is, as I said, chair of the Metropolitan Council, largest transit operator in the state of Minnesota, does land use planning, and certainly have been providing this essential service during these very difficult weeks and months. Charlie, I'm going to just give you the floor to talk about how you at Met Council have been approaching this issue.
Well, thanks, Patrick, and thanks, everyone. It's an honor to be here, and here I am in my home and overlooking Cedar Lake in Minneapolis, but I guess I feel like I'm in Rochester. I have to say, you know, staring at screens is not something 6 weeks ago I think I'd be doing as much of, and of course, that's kind of our day, and it's amazing how we have not socially distanced. We just physically distant, but we stay connected. I have to say, Met Council that operates Metro Transit, which is really at the front line of what we're dealing with during this COVID period, is one where there's good continuity of operation, there's good disaster planning, there's how we handle our governance, there's even how we have offsite meetings. But it was always contemplated that that would last for a very short period. It's not like, oh, okay, this is months, and how do we do business as usual when it is so unusual? So I think that particularly when you think about transportation, one of the ways I've always thought about transportation is it's not loving the field itself, it's what it does that is so critical for people's lives. When you think about the economic lifeblood of our businesses, how we consider livability, it is always, or the environment, it is always kind of transportation that is kind of right underneath all those important factors. And so when we look at Met Transit in particular, thinking about how do we keep it safe, how do we measure the level of service? So, and we have lots of data and graphs, but pretty much in about a month period, we've reduced the service to maybe 35% of what we had during the full peak periods of 2 months ago.
So are you saying, Charlie, are you saying you've reduced the service or ridership has gone down?
Well, both. And you can actually watch this graph and actually see our weekday ridership on the different parts of our transit system. There's the light rail, local bus, and express buses. You know, this express buses were probably those folks who could telecommute more readily, so they're more office workers. The local bus is kind of leveled off at about, at a 60% reduction. And then light rail is dropped off in part because we reduced the service. We reduced it to about 9 o'clock in the evening to 6 o'clock in the morning. And I think our point here is that we've always carried essential workers. We have essential workforce taking care of essential workers. And we're really at that point. Nobody is really taking transit now that isn't really getting to their essential job. And that's about to open up, which is kind of where we're thinking about the future. But it shows how critical this transit service is for those that may not have any other option, to get to the hospital, to get to the sanitation area, to get to a grocery store or a food source. You think about the workforce that is keeping our economy alive, and what we are sequestered in our home are enjoying. A lot of those folks are carried around by our transit system. So, and this is the same thing with Jefferson Lines that operates in 14 states, scheduled service, but it's pretty similar dynamic, probably reduced schedules by about 40%, but it continues to serve the interconnection of about 200 small towns and big cities in the whole heartland swath of states who are carrying students home, workers to senior facilities, healthcare workers. I mean, those are an agricultural economy. I guess the point is we found how much transit really is critical to the economy. And doing that, how do we keep it safe has been a big challenge.
I want to just hold on that graph, Aaron, just go back to that graph for 1 second, because I think it, in a way, it's the compelling storyline here is the blue, if I'm reading this correctly, is blue
that's
local buses?
That's the real core of our system is the bus system.
So what that really is showing us is the ridership that is going to maintain even during this most difficult time, because it's made up of people for whom I often say for whom the word public transportation is a redundancy. For them, it's just plain transportation.
And I've often said it goes against every one of my bus bones in marketing that we're out there telling people not to take transit. And, we're actually saying, this is for essential trips. And some routes are crowded because they're very important pipelines for employers to employment. And those routes, we actually double up the buses. We've maintained now a limit on the number of people, only 10 people on a 40-foot bus, 15 people on a 60 articulated foot bus to maintain the social distancing.
Well, maybe I could just ask Ia to weigh in here. Ia, in your role with City of Rochester in transportation project planning, describe for us what are some of the techniques that are being used here locally to make the bus rider safe and the bus driver safe, because people who are using buses today is probably people who are, as Charlie is saying, are getting to essential jobs, and this is their means of transportation.
Right. Yeah, I just want to echo everything that Charlie said. I mean, whether you're in the big city or a city the size of Rochester, the trend has been the same, where we have seen those that do depend on transit is still taking it. Our ridership fell dramatically, just like Metro Transit, and then it leveled off. So really speaks to the need that transit is critical. It's an important service for folks out there. What we've done is obviously the social distancing is important. We have, ever since the pandemic has started, we've looked at different approaches to get to where we are now. We started reducing services and then increasing our number of buses to those areas where there's more to allow for that social distancing, so that when there's 15 or 20 passengers, then we bring a backup bus for the other passengers. So that as ridership dropped, we didn't need to do that anymore, but I can see that when businesses start opening up, we'll have to start ramping that up again. So we may be needing more buses as backup to provide that social distancing. We also have increased our cleaning, not that we haven't cleaned our buses, but we clean it daily now. We also, we did it by hand, but as we continue doing it, you can see in that picture, we have a sprayer that we're using, so it goes quicker, and we're catching everything in there. We also have blocked off the front of our buses. So we're only doing rear entry. So that limits that interaction with the bus driver. The only front is used for those that need it with wheelchairs. So we've blocked that off.
And do we? And I think we may have a picture of that, the front front loading or rear loading only. Did you show us?
I'm not sure if I have that, but the tape there shows that those that enter in the back can't get to the front. And I didn't provide a sign, but we do have signs on our buses that says rear door entry only to allow that. We also encourage our passengers to have face coverings. And if they don't have any, we provide, Rochester has a hotline where they can call. If they qualify, they can get a mask. And a face covering can be anything. It can be a scarf, it could be anything that you have. So most people would have something to cover their face. And so we're promoting that. Our drivers also have masks and gloves and sanitizers. So that's something that they have. I would say that safety's always been something that we have addressed. Right now, it's just that we're addressing a different kind of safety. We have cameras in the buses, and now we need to provide. So one of the things we're looking at is we currently don't have barriers or plexiglass for the drivers. And so we're looking at that different option is how do we need to install something like that for all the buses?
So one thing, yeah, I'm sorry to interrupt, but I just want to say to John, Ia said something that I think is that, and I'll come back to you, Ia. Ia said something that I think is interesting around this idea that public safety has always been a part of transportation, and it's been a part of providing for both worker and customer safety for forever. And you keep evolving that and keep adjusting that. Certainly we know that about airports. And I wonder if, by the way, are we going to possibly see Vice President Pence walk behind you?
He's already landed and taxied by the window just a little bit ago. So he is here and in town.
So we missed him. I flew into Rochester International.
Absolutely.
Yeah. So talk to us about this notion of this being an evolution of the safety that we keep building into our systems.
Yeah, absolutely, Patrick. First, let me say thank you to you and DMC and everybody else here on the webinar for joining today. And again, I've been in aviation now for 29 years, and I'm old enough to have been around before there was even checkpoints and security. And now we move through TSA as if it's normal. It's part of the experience, and it's just become part of the norm. And I do believe in time, safety protocols related to yourself and employees across airports and other transportation nodes for that matter are going to incorporate new measures into what they're doing. I can feel it already growing within the airline industry. Just yesterday, JetBlue announced that if you're going to fly with them, you have to wear a mask. American Airlines just announced that they're going to be handing out PPE to passengers who want to fly on their plane. And I think as this continues and grows, airlines will coalesce around some basic ideas towards safety. And I've got to think out loud that they'll work with chosen healthcare partners to develop what that really looks like for their operation moving forward. It's about your safety. It gives you a feeling of comfort so that you can continue to move around the country and the world and do your business. And 5 years from now, it'll be the norm.
Tell me, 5 years from now, it feels like it's been 5 years in the 5 weeks or so. but other parts of the world face this earlier than the United States. And given your connections internationally, John, I wonder, are there some things that you've learned from colleagues in other parts of the world that seem to be working, that wants to happen here?
Yeah, a great question. And, I could feel the impacts internationally well before, the United States started slowing down and shutting down. And we started feeling this first as the president began to shut down China to Asia, or into China. And then you can begin to feel it come out of Europe. And, about 13 to 15% of our travelers that fly through RST are international travelers, those coming from other countries coming here. And you can begin to feel that. I think as you look towards Europe in particular and Asia as well, they're going to take more dramatic moves quicker and faster than probably we are in the United States in relationship to health and safety. And I think there's a lot to learn from that outside of the US. Those airlines in Europe in particular have really, really shut down. There's not a lot of movement. You begin to feel that already in China. Movement internal to China and limited international excursions are beginning to spin up. You can already see some of their expectations or that PPE, but then again, that's almost standard in Asia that you wear your PPE. So yeah. You can begin to feel that already. It'll be interesting to watch our international passengers return and what measures they personally take for themselves. They've experienced these things long before we have.
Sure, absolutely. Absolutely. I want to come back to something you just said, but before I do that, and Laura, before I put you on the spot, and I'm going to, because you work in this private transportation world, which is really in many ways the intersection between public and private, particularly here in the Rochester environment, where so many visitors are coming for services at Mayo Clinic. But I want to say that we do have the Q&A box open, and we want to encourage participants to ask questions. And there is one out there that, Charlie, if you click on that, it's aimed at you. And it's a question for you to do a little forecasting about the impact of COVID-19 on the state's bonding bill and projects and timing. So I'll let you take a moment to decide how you're going to answer that question. But mostly I want to encourage the audience, and we will field that question, but I want to encourage the audience to feel free to ask questions, or better yet, offer up ideas and advice or suggestions. Maybe you come from other fields, or you've seen something in other places that you want to suggest and perhaps get a reaction from this panel. So I encourage you to do that. Next up, Laura, talk to us about how are you going to running a private transportation business? And if I understand your business, it includes both a black car service, but also a shuttle service, a bus service. And these perhaps are oftentimes patients and families going from hotel to the hospital or clinic. Is that right? Am I saying that correctly? And how are you going to convince them that they've left a safe environment of a hotel and going to a safe environment of the healthcare, and in between they have your service? So tell me how are people going to gain confidence in that service?
Absolutely, Patrick. Thanks for having me this afternoon. Chamberlain's highest priority has always been safety. We're a very detail-oriented company when it comes to the experience of our customers. And when this shutdown was first announced, our priority was to partner immediately with our hospitality and transportation stakeholders and discuss what type of service does this need to look like. I think immediately it was transparent communication, as well as PPE available to our employees and our guests. You know, most of the individuals that come to our community are here and they're already quite anxious. They're here for a diagnosis. It's not necessarily sunshine and rainbows. And they have a tremendous amount of stress, I would say a little bit overwhelming experience. And our goal is to really alleviate that and to have every individual who utilizes our service feel safe, comfortable, secure, and to know that we are doing everything we can to provide that environment, whether it's spatial distancing in a dedicated black car, We're going through a very intense sanitation process, which we've already kind of had in place, but now we're implementing it in a different type of experience. So this is kind of an example of our station of PPE. We're doing temperature checks between transportation reservations and between each guest, as well as hand sanitizer, gloves, and masks. Our vehicles have signage that this vehicle has been sanitized, obviously due to the COVID-19 outbreak. And we're committed to continuing to do that. This process is it's detailed, right? Everyone in transportation knows that there's a lot of things you can touch in a car. And it is important to us that every person that enters our vehicle and exits our vehicle knows that they're accessing something that has been completely decontaminated and sanitized appropriately. This is our office area, and that X obviously is a symbol of the 6 feet. We encourage everyone in our building to practice 6 feet in social distancing, and this is our window to our dispatch center. So we can communicate via text and technology, but also face-to-face with a barrier.
Great, thank you. So I do think that little examples like these that are sending signals to our customers that we understand their concern, that we understand that they want to be in safe environments. I mean, part of safety is also creating a perception of safety, a perception that sensitivity around that. And certainly many of our customers are here. They maybe have health compromise, they're health compromised, they have special needs, special concerns. And I think that's a critical piece. And it makes me think about sort of this relationship between, as I said, people who fly into Rochester, people take private shuttles or taxis or other public transportation, enter a hotel, and eventually get to their medical service. Charlie, what do you want to say about bonding and the impact COVID is going to have on? I mean, I don't know if the rest of the audience can see the question, so I'll ask it actually so everybody does see the question, understand the question. Please ask Commissioner Zelle about COVID-19's likely impact on state bonding and projects and timing.
That's a great question because all the legislative attention right now seems to be on COVID, both safety, any kind of economic mitigation, and what needs to be done to fuel the recovery, the economic recovery. And so if it doesn't have to do with a kind of a COVID-19 response, then maybe the legislature is not looking at that. Having said that, the bonding bill has always been this incredibly important economic infusion of jobs, capital assets, rehabilitation, really important projects for our state and for our economy. So I think would be a strong interest from the legislators to go forward. And I know Governor Walz would be very open to it, but will they get to it in the next 3 or 4 weeks? Would it be done even later in the year? I think remains to be seen. As you all know, the bonding bill requires more than a majority. It requires a supermajority, which means that there's a lot of consensus building. And given that the legislature's been away, it's kind of hard to kind of be able to kind of put together the kind of list of projects. So I personally, I think it could go either way because it is not a done deal, even though it would be really important to do this year.
Yeah, that's really important. Another question that came in really asks about collaboration, and this question comes from Mark Ritchie, who noted the accelerated collaboration that seems to be going on between Mayo and the University of Minnesota. It's probably raised the consciousness of Minnesotans about the important role that Mayo plays at the global level, and perhaps Mark Ritchie is asking really what's the silver lining? What is a silver lining in this? So I'm going to repurpose the question and ask really about, is there a silver lining around collaboration that you see happening in your industry that is something that can be sustained over the long term, as we're all trying to solve for the same issue. And I'll let Ia be the first one to respond and open that up to anybody else who wants to respond. But is this sense of urgency, the sense of common enemy, creating a level of collaboration? Ia, you and I were part of the Bloomberg program, Bloomberg Harvard program, that's really all about civic collaboration, and that predated COVID, and it turns out what a great skill set to have. But could you comment on your thoughts about how collaboration seems to be an outgrowth of this single enemy?
Yeah, I think that there has always been collaboration with all the different partners, Mayo being one of the biggest ones in Rochester, but there's others. And this has really actually brought it to the forefront. There's opportunities now. For example, we have autonomous vehicles that we were going to test out this summer. That's a great innovation piece that I think might just accelerate the use of this. We also were part of a consortium for automated buses to be tested in Rochester. And I think that's another great opportunity for collaboration with MnDOT and other and Mayo and other partners on moving those forward. So I think at this point in time, there's a real great opportunity. You just have to seek it out, and everybody is basically working towards the same goal, thinking about how we can bring back what the new normal is going to look like.
What does the new normal, Charlie? What does the new? I'm going to let you respond, but I want you to tell us what the new normal looks like. But go ahead.
Only because I'm such a big Mark Ritchie fan, I want to jump in and just say that our future is going to be, always was, but maybe even more now, dependent on these cross-sector collaborations. And I mean, I've heard it described, and I think it's true, that what's happened with this pandemic is it just accelerated the future right in front of our face, that it was happening anyway, but now we really have to dig in and think about marginalized communities differently. We have to think about how we manage our economy, how we work toward maintaining this region, and particularly in areas of health, areas where we lead, to become more of the kind of a global leaders. And when you think of Governor Walz and Vice President Pence today, I think it's an example of where we can set ourselves apart. So I think those are wonderful opportunities to kind of set Minnesota forward. And the other is when you think about the role that all these intersections with transportation, it's not just about buses and trains, it's about how we're going to live our lives. So the new normal is going to be different. And how different is the real question. We're at Met Council measuring through 7,500 people we survey to create kind of a travel behavior index. And it's not just how people travel, it's like, are you working from home? Are you going to continue to work from home? Telecommuting will be probably on the rise. We realize it's actually pretty efficient. When we think about the importance and rise of biking and walking, I mean, biking is by 200% growth, where traffic is down, 60%. I think the fact that Minneapolis announced closing of more streets today, are they going to start, and the park board start ratcheting that back as the economy recovers, or are we going to insist on more walkable places? Because I think this idea of social distancing is going to be with us for a while. So how do we think those patterns of behavior continue, and then how will we sustain them even going forward? I think that there's, it's the great pause, but it's also kind of the great reset of how we think about the role, both transportation and how we think about even the idea of the 9 to 5 work life. Maybe we need to be rethinking rush hour. Maybe we should be thinking how we price our transit and our interconnected mobility so that it doesn't have these surges, which are both inefficient, but also, frankly, not as safe. So I think that we're going to be kind of learning as we go as this world adapts.
Well, one thing I've always loved about you, Charlie, is finding the silver lining, and now referring to this as the Great Reset. I think is a way of signaling optimism. And Laura, tell us about the reset that you think in your business that you're gonna experience. I know some of your shuttles are for events. What do events look like in the future in terms of how people are going to experience or what they're going to expect of those?
Certainly. You know, transportation efficiency has always been, what is capacity? Let's make capacity happen. And I think now efficiency within transportation and events is more a shift of efficiency is safe, it's calm, it's quiet, it's gentle, and it needs to have a little bit more sensitivity. I think, how do we move people in a space that's safer in an environment? I think I can't really speak to the immediate future or I guess, as this evolves. I think events will be different, right? I think people are gonna be quiet when it comes to maybe entering the social world. As far as transportation and events, I think that our service, we're exploring barriers similar to larger transportation systems. We're experiencing a lot of reset when it comes to weddings and larger venue events. What does this look like? And I can't really speak to it as an event manager, but as far as transportation, it is really about creating a space in between the driver and the guests and the passengers. And I think this also means schedules change, right? Operating changes. I don't think operating authority changes, but I think that, you know, we can't have a 45-minute turnaround time now. I think it will be longer, and we're going to have to practice a lot of patience in that realm.
One of the things we heard yesterday in the discussion with leaders around office space and as office spaces reopen was this notion that there are physical barriers. So there's a part of it that's just, you know, social physical distancing and barriers and masks. But then there were lots of ideas around programming, kind of what you're saying, Laura, but perhaps you stagger shifts, you rotate employees who will work from home on a given day or multiple days, but you have certain days where all staff are hopefully in the office. From a programmatic point of view, thinking about this from a programmatic lens, Charlie, given your role not only as a transit operator, but also land use planning and planning and development in the metropolitan area, what's the intersection between the sort of immediate steps that have to be taken around social distancing to sort of more programmatic changes? So you mentioned, and maybe it would be worth describing for the viewers a little bit more about this idea of closing streets, because I don't know that everybody knows what that's about. It might be worth just describing what that's about.
What Patrick's referring to, and I should also mention that when Met Council has a large planning organization, we also kind of oversee the large regional park system of the metro area. That's we call them implementing agencies, but that's the city or the county park systems, which are a regional resource, or often part of our planning and part of our funding. And take Minneapolis Chain of Lakes as an example. The Minneapolis Park Board has closed off many of the parkways around the lakes and along the riverfront because there's a reduction of traffic, but also there's a real premium on open space for people to bike and to walk. And even along Lake of the Isles yesterday, I was there, even with the parkways closed off, it's starting to get crowded. And as the weather starts to warm, how do we provide resources, places, so people feel safe and to be outdoors? And I think that when I mentioned the park system, we're really blessed in the metro region and throughout the state with an amazing amount of open space. And so we have to find ways that people feel comfortable to go to any number of places to be like living our lives outdoors. So I think that gets into planning. When you think about, you know, I've heard the argument, well, is density unsafe? No, I think density is okay. It's how it's managed. You know, are there places and ways to go? Is there? It's more than just, it is distancing, but it's also what you touch, what you don't have to touch, what with the use of masks. I've seen questions about masks on transit. You know, our operators now have masks. We encourage all of our passengers to have masks, just like what we're doing in Rochester. Well, we're going to start seeing that when you walk around the lake and when you go to your work. And I think that becomes as much cultural as it becomes the law. The best practice of any employer now will be to show up, you know, with your mask. We know that in the construction field, in some of our projects, initially the outside workers weren't wearing masks. Well, more and more, partly because we're requiring it, people working in close proximity could be within 6 feet. You're still wearing a mask. So I think that's it is becoming more of an accepted. And as John said, we're learning this from other countries, the way people will live.
So one thing I'd like to do, I mean, we're running close to the end of our hour, and I know that people are really interested in perhaps an innovative idea you're not quite ready to do yet. Maybe you're testing, maybe you're exploring, maybe you've seen somebody else do it. So what does long-term look like? What's a long-term step or innovation or approach or concept that you're thinking? Because imagine we have school buses, we have, you know, loads of school kids that we hope someday will be going back to their physical environment for schools. I know a lot of parents are hoping that, and so that those vehicles need to be, that experience needs to be made safe. We have our car and the car sharing programs and micromobility like scooters, all of those forms of bike sharing, all the forms of mobility that we want to think about and want to make safe. So I'm doing a little tap dancing here to give you guys enough time to do a little lightning round of one or two innovations that you've heard about perhaps, or that you're exploring that might find its way into your business. And I'm going to look for somebody to make eye contact with me. I'm going to call on you first. Good. It sounds like everybody's ready to go. So yeah, please.
I don't know if it's that innovative, but it is certainly changing what we're looking at, or maybe like we've mentioned before, speed up what we are looking at. So obviously I've talked about the autonomous vehicles, which I don't think it will be here anytime soon, but that is certainly, I want to say, a tool in the toolbox for us, and certainly more of an option. Other things that we're looking at is fare technology, being as contactless as possible. That's something that we're looking at now. We have always had that on our list, but I think once again, it's just sped up that opportunity. We are also looking at like the plexiglass barrier for our drivers. We don't currently have that. Some transit agencies have that, but we don't. So once again, that really is something that we're looking at. And so that's just something that a lot of these things that when you ask about that, it's already available. It's just that we haven't gotten there yet. And I think we're going to get there a lot quicker. Also, we want to be flexible so that if there's any other opportunities or new inventions or innovations that comes up, we want to be available and ready for that. So the flexibility of it is also key.
Somebody said to me that the most contactless fare technology is free fare. So Charlie, what about free fare?
Well, you just saw from that picture, we are not collecting fares if people are coming in the back doors. But I'm just going to build on what Ia said. I do think maybe it's the end of cash and how we are using technology, something that we've talked about, but now it's like, you know what, it's time we get it together. It's not just go cards and a payment system. It's actually routing from the passenger's point of view system. How do we integrate schedules between modes? So you're not only riding your bike, you're taking onto your bus or your train or your plane, and it becomes more seamless, and it becomes also more real time. We should have technology to know how many people are on the bus, and is it limited or is it not? when do you actually come to the platform? You don't want to, the idea of waiting around in big crowds, we're going to be now having more kind of real-time queuing in terms of mobility. And so I think the innovation is going to be things that we've talked about and been dreaming about that we're developing, and now it's going to be putting more urgency to start putting those integrated scheduling technology systems together.
John?
Absolutely. You know, from our point of view, I would say this airport was a little bit ahead of the curve, believe it or not, with our cleaning. We've always used a combination of medical grade, non-medical grade cleansing materials. We've just amped up the volume here. We too will make a quick move towards some physical separations. You'll see those very soon pop up here at our ticket counters, gate counters, ground transportation. You know, here's a mock-up of what that will be. But more importantly, the industry had already been moving away from touch points. I think this begins to accelerate that. I will say my last trip was to Washington, D.C. It feels like an eternity ago, but I think it was less than 30 days ago. And I actually had pretty much a contactless interaction within, I think it was United Airlines. I came in the terminal, I used my app, I checked in. I requested my bag tag. It was presented to me. I put that right on my bag, took it to the TSA, and I was off and running. I think airlines will begin to accelerate that type of interaction. I think, you know, obviously, I think they might have thought that might have been a better experience in the past, but I think people are going to begin to look at that as something that they just demand moving forward. So I think the platforms are there. I think it's the utilization of some of those apps that we already have and that we already use on an everyday basis, especially within the aviation industry, that will accelerate and move us forward.
Laura, you are concierge. That sounds like a high-touch business. Seems like an experienced business. So how do you make that work?
Certainly, it's quite individualized. Everyone that travels in medical tourism has a specific set of needs. But no one wants to feel like cattle, so to speak, right? They don't want to be pushed into a direction or close to strangers. It does incite a little bit of anxiety, like we mentioned before. And interaction will be key, especially within technology. So that's automated text messages of saying that your vehicle is outside. Maybe there's some opportunities within our hotel partnerships or as well as the airport and private aviation of when and where you can expect your vehicle to be and how far away our driver has interaction with you. And I also think this helps us explore barriers, right? So if this means implementing a plastic barrier in our dedicated black cars, if this means a curtain, so to speak, as well and within our buses, it allows us to have some flexibility and to adapt as this continues to evolve.
You know, that's really great. What is so exciting to hear is these themes that are emerging, and we heard this yesterday at the office group. We hear it evolving in this conversation. We're also hosting a series at DMC on our blog series called Business Pivot. And as we are hearing about exciting transformations that are happening, it's a great resource and featured last week are restaurant and retail and some other operations that are taking this opportunity now to do what some of you are saying, which is just accelerating on something that perhaps they wanted to do anyway. And so this whole idea of these conversations, the kind of pivots that are happening, are really coming out of this disruption that's forced upon us that perhaps we would never wish upon ourselves or anybody, but being responsive to it. And you guys are proven leaders who are clearly operating at that level, that this is not going to derail you, but in fact, it's going to inspire you and create a better day for all of us. We're going to wrap up in a couple of minutes, but I would really ask if the audience would help us by giving us some feedback. There is 3 more in this series of webinars yet this week. Tomorrow, we're going to talk about hotels and lodging and conventions. And Thursday, we're going to talk about reopening Main Street. So think retail and restaurants. And Friday, we're going to be talking about public space and festivals and events. And in this whole series, you can see that there's a lot of connection between the innovations that are emerging. And so we'd love it if you would, as audience members, if you would give us some feedback that we can use to help continue to improve these conversations. As for wrapping up, I do want to just take another moment to thank Charlie and John and Ia and Laura and the DMC team who organized this series and today's session. I think it's been an incredible conversation and, as we said, both practical and inspiring. And I think for my part, you all lived up to it. So I'm going to ask the audience to join me in a virtual round of applause for this incredible group of people. Thank you very much.
Patrick, thanks for having us. Thank you.
Yeah.
Thank you, Patrick.
You guys all manage you manage your mute buttons perfectly. No, no problems. This is what it's like 5 weeks into remote meetings.
We get good at the unmuting.
That's right. That's right. Well, be
Thanks,
well,
Patrick.
be safe. Be safe. Thanks a lot.
You as well. Thank you.
Thank you.